Welcome back. Now, earlier this week, several European agencies came together in support of the African Medicines Agency. A substantial amount of money is being injected into strengthening the initiative. The support also forms part of the Team Europe initiative on manufacturing and access to vaccines, medicines and health technologies in Africa. Now, for more on this, I'm joined by Chimwemwe Chamdimba, African Medicines Regulation Harmonization Program. Thank you so much for joining us this evening, Chimwemwe. Now, this sounds very exciting. Tell us about the reasons behind setting up the African Medicines Agency and how it will help.
Yes, thank you very much for having me this evening. Actually, the African Medicines Agency was set up by the African Union. Its treaty was adopted in 2019. And the aim of the agency was mainly to support our governments to set up strong national regulatory authorities that will work towards supporting their member states to regulate medical products. And these medical products include the medicines, the vaccines, the diagnostics, as well as the medical devices that we use in our health systems. So the African Medicines Agency was set up to strengthen the country efforts in regulating medical products, mainly to create an enabling environment for the pharmaceutical sector growth. You know what we went through during COVID, but also during the HIV/AIDS time when the pandemic was at its peak, when ARVs were made available elsewhere in the world and not on the continent. And as a continent, we needed to come together and set up an agency that will enable us to regulate the environment so that we can attract trade, we can attract investments in the pharmaceutical sector in a way, thereby making access to quality assured, safe and efficacious medical products to our people. So in a way, it is meant to address both the public health goals as well as the investment and trade goals of the continent when it comes to pharmaceuticals.
So it's not just, pharmaceutical medicine that will be provided as well. These are resources that can also be used in state hospitals as well across the continent. So this would also include equipment and things like that. If you could elaborate on the kinds of resources as well outside of only just medicines.
So when it comes to the support that the African Medicines Agency will provide, I think you've rightly said in the hospitals, we cannot talk about a public health system or any confidence in a public health system unless that public health system is anchored with the right medical products, the medical devices, the medicines, the vaccines that are required to deal with public health challenges. So what the African Medicines Agency will do is that it will make the environment, or it will provide an enabling policy as well as regulatory environment for investors to be able to come in and produce those ones on the continent so that they are accessible to our public health services, so that they are not deficient when we need them to deal with the challenges that we have. So in a way, I think the resources that are being pumped into the continent, yes, part of it is focusing on the regulatory aspect, meaning that the environment for investment in this, but also some of it is going into the actual manufacturing and the actual production of the products that we need to deal with our health challenges as a continent.
Just this week, Chimwemwe, we had an organization in South Africa called the Treatment Action Campaign. Now, they have advocated for when it comes to TB medicines, but also when it comes to HIV and AIDS. And we were speaking earlier about that access to ARVs, particularly in the earlier days, access to vaccines as well. And the Treatment Action Campaign this week then marched to the headquarters of our health department to say, look, you're not paying enough attention to medicines around tuberculosis as well. It is a huge killer in the country and the continent at large. Will this kind of initiative help with diseases like tuberculosis as well and access to the treatment that is needed?
Exactly. So actually when we were establishing the African Medicines Agency and when we were adopting the pharmaceutical manufacturing plan for Africa, we were targeting the diseases of priority for the continent. And if you look back, the AU adopted the AU catalytic framework to end AIDS, TB and malaria. by 2030. And we know that we cannot address these challenges unless we have the right tools to be able to deal with these challenges. So TB is one of our priorities. And I think you're right. That what makes TB even more complicated is that apart from having the ordinary strains that we have been struggling with, we now are struggling with drug-resistant TB, meaning that we need new tools, we need new medicines to be able to tackle them. We even need vaccines that should be able to deal with diseases such as tuberculosis. So what the African Medicines Agency will do is that it will attract those into the continent. It will make sure that those are made available, but not just made available in whatever form, but we want to make sure that they are of good quality, that when they get to the patient, they will treat what they are supposed to treat, and they will also make sure that the patients are safe as they are taking those treatments. So the African Medicines Agency indeed will play a role in facilitating access to these medical products that are needed by our population to deal with these priority diseases.
Focusing on the continent again, Chimwemwe, we're speaking about TB being a major problem as well. As you've mentioned that you've also picked that up too. There's already initiatives and programs in place for that. What are some of the other key diseases that the AMA will be looking at?
So the AMA will look at priority diseases of the continent. And these priority diseases, as I said, we know they are infectious diseases such as HIV, AIDS, TB, malaria. We are also looking at some of the neglected tropical diseases, the diseases that really nobody else is looking at. Nobody will invest in our problems unless we invest in our problems ourselves. So what we did at the very beginning, when the African Medicines Agency Treaty came into force in 2022, I talked about it being, 2021. I talked about the treaty being adopted in 2019, but it only became effective 2 years later, when we had an adequate number of countries being parties to the treaty. So what we did at the very beginning was to categorize what kind of products will African Medicines Agency prioritize. And one of the criteria for prioritizing products is to look at the disease pattern of the continent. What are the main diseases that are challenging us as a continent? And what are the diseases that need medical products developed for us to be able to deal with them decisively and end them? Because there are diseases that were eliminated some time back, the neglected tropical diseases, elsewhere in the world, and we're still struggling with them on the continent. And as you know, TB, we are also one of the highest burden continents compared to other world. So we have to deal with, if no one else will deal with these problems apart from ourselves. So we have to invest in dealing with these problems. And at the center of it is, as I said, having the right tools, having the right medical products that will enable us to deal with those challenges.
I'm also assuming that this will also attract the right skills as well, because there will be those in the medical profession that will then need to come and assist with this role as well.
Mm-hmm. Most definitely, we need the skills as a continent. We need the right people. I mean, we can't talk about pharmaceutical manufacturing, for example. We can't talk about the regulatory science unless we have the right people being able to do that. We can't talk about delivery of the medical products that we need to the population from end to end unless we have the right people doing that. So what we have also done as African Union within this same program of the African Medicines Agency is that we have set up regional centers of excellence that are driving capacity strengthening in the different specialized areas that we need to do drug development until we get the drugs to the people that need them. Secondly, we also are establishing currently a College of African Regulatory Science profession, mainly for us to be able to have a cadre of regulatory scientists that will really guarantee the quality of the products that we are targeting to manufacture on the continent, and we are targeting to put them on the bedside of our patients for them to deal with the challenges that they are suffering from.
Now, I love what you're saying when you're saying we should invest in our own problems. How much have African countries and the AU contributed to this? Because I believe the European Commission has announced a contribution of 10 million euros, with Belgium's 4 million euros contribution to big monies. And also, how will that be spread across the continent?
Yes, you're right that we need to put our money, where our problems are. And unless we do that, we will not be able to deal with our challenges. We know the budget is huge. For us to establish such an agency for the continent, it requires a lot of resources. From our end, as the African Union Development Agency, our role is to provide the technical support that is required, building on the work that we have been doing on the African Medicines Regulatory Harmonization Initiative, to set up a technically competent regulatory agency that will be able to deliver. And we, in the last 2 years, we've invested in developing a continental plan, which is huge millions in terms of, and we know we need hundreds of millions to set this agency up. And as you're saying, the 14 million is just a contribution. But if you look at it, the bulk of it is being provided by our member states through the African Union and the work that we do through the African Medicines Regulatory Harmonization Initiative. Recently, in the just ended summit, there was a landmark decision that was made by the African Union that yes, we have currently 26 countries that are parties to the AMA Treaty, but we don't want to leave the burden of financing the AMA Treaty on just these 26 member states. So they've made a decision that we are going to be providing annual funding to the African Medicines Agency for it to take off, because we can't just let partners to invest in an agency that is going to deal with our problems as a continent.
Yeah, and speaking of that, what does Europe stand to gain in this, or is it all for altruistic reasons, for the betterment of Africa, to just pump, tens of millions into this?
No, every partnership is a win-win, and I think that's how we need to look at every partnership. And what we have established with the European Union, as you're saying, is a partnership that is going to benefit both sides, the African Union as well as the European Union. And it is going to benefit both sides in two ways. One, in public health. You cannot talk about global health unless we deal with global health issues. And Africa is part of the globe. Yeah. And what now Europe knows is that if you neglect health challenges in Africa, just taking a plane, you can move from here to Europe in a day. And if you have a communicable disease, most definitely you're transmitting that disease. So for us to be able to deal with health challenges, similarly, even people can come from their side to our continent and spreading diseases in a way. Diseases know no borders. So that is why they are investing in this. So that is one side of it, public health. The second side is that, of course, when we have the African Medicines Agency, we are making the continent attractive to investment in manufacturing of health products. And I think everybody knows that with the African growing population, we have a growing middle class, and we are the next place to be. And who doesn't want to partner with the next place to be? So definitely, it's a win-win situation. We win in a way that will, expand our capabilities as a continent to manufacture the medical products that we need. By the way, when you look at it, we have quite a lot in terms of the population, and our market is worth billions. However, we only have 5% of what we need as medical products currently being manufactured on the continent. And we cannot afford to do that. We have the 95% gap that we import from elsewhere in the world. We want to stop that importation and have those investments in the African continent, and us being able to even supply to the globe. So everybody stands to win if Africa produces, and if Africa is healthy, the world is healthy, and the world is also economically, we win as a globe. So that is why we are partnering with the European Union and member states of the European Union, partnering with member states of the African Union for us to drive one common global health agenda.
Oh, 100%. Well, thank you so much for your time, and good luck with that as well. This initiative is not only exciting, but it's definitely necessary as well for the health of the continent. Now, that was Chimwemwe Chamdimba, African Medicines Regulation Harmonization Program at AUDA.